Hey there, GLA friends and family, and welcome to our Why It Matters series as a part of our Giving Hope emphasis in September and October. This video gives us the opportunity to explore ideas a little bit more and talk about their context in Haiti, talk a little bit about why we chose to focus on them, and then even discuss how they affect God's littlest angels today. Affordable and accessible healthcare has always been a challenge in Haiti. And with increasing violence and insecurity in the capital, it's become even more difficult. Many of the hospitals and clinics in Port-au-Prince and the surrounding regions have closed entirely or have at least done away with most services and are operating at a minimal level. In fact, Doctors Without Borders has nearly pulled out entirely. And so as things like gun violence and kidnapping and crime are on the rise, meaning that there's a greater demand for those services, the actual availability and affordability of those services has gone down quite dramatically. This dwindling access to care, and the affordable care at that, is of special concern to God's littlest angels, both as historically a healthcare provider in Haiti, but also because it is one of the primary factors and leading causes to the orphan crisis in Haiti as a whole. Many families are faced with a difficult decision when a medical emergency arises. They have to decide whether they're going to go seek and pay for necessary medical care, or if they're going to provide for the basic needs of the children in their family. And so many families are forced to make the very agonizing decision to place their children, some or all, into institutional care that can provide for their basic necessities in order to be able to actually obtain the needed medical care. And so it creates a cyclical effect in the orphan world where children are placed up for temporary or permanent assistance and even labeled as abandoned as a result of needing medical care. This factors in for God's littlest angels at a couple of different levels. Firstly, we have children that we are caring for that are on site living with us on campus, and we have to provide for their unique medical needs. This involves assessments to identify each child's specific need that often results in not just basic medical care, but need for speech or physical therapies or trauma counseling. And so we have to develop a plan that is specific to each of those children and then begin to pursue that medical plan through to the end for their well-being and in order to help them to thrive. But it also begs the question of, as a historically medical organization, how can we begin to provide for medical needs for the community around us in our new location, and what are we able to offer? Because that allows GLA to move not just in a triage manner as a way to take care of and address the symptoms of medical costs and lack of access, but also to begin to be proactive in providing medical care that can make generational difference down the road. What this means is, as GLA is able to begin providing access to quality, affordable health care, we can begin to be proactive in the orphan outreach and ministry world as well by preventing families from having to make the decision between quality health care and taking care of their children. And so the long-term benefit is we can begin to help partner with communities and families to break the cyclical effect that medical emergencies have had in the orphan crisis world. In doing so, we can help keep families together, which is to the benefit of the community, to the family, and to the child. And all of that can be achieved through providing good, quality, affordable medical access. I hope as you explore the idea of giving health that you will consider being a champion of hope through healthcare. If you have any questions or want to discuss further, we would love to continue this conversation with you through email or on the phone. Thanks so much, and God bless.